Hello, I'm Tannaz for the Power of the Patient project. My guest today is Renee Langstaff, a physician assistant and department chair and program director, medical science at Arcadia University in Glenside, Pennsylvania. Renee is also the founder of Sidz Kidz, LLC. The mission of the Sidz Kidz is to prevent sudden cardiac death in youth through cardiac screenings, AED availability, education, and research, as well as to support families in dealing with a cardiac diagnosis in children. Renee graduated with distinction from Arcadia University's Physician Assistant Program and was awarded the prestigious Alumni Achievement Award in 2013 in recognition of a stellar record of academic excellence. She has 20 years of experience in cardiology and still practices clinically in this field. Welcome, Renee.
Thank you so much, Dennis, for having me.
So Renee, before we start, I just wanted to interject that Arcadia University has a special significance to the Power of the Patient project. The project began in Arcadia in 2014 when our executive director, Bob, started it with 14 of his healthcare administration students. So we're very pleased to have you with us today.
Thank you so much. That's wonderful.
So first, please explain the role of the physician assistant. We need them in our doctor's office and in the hospital, but what is their role in the healthcare delivery system?
Sure, that's a great question. So PAs are educated in general medicine, which means that they have an education that's based on in the medical model, and so they're trained to practice in any specialty and in any state, and they're groomed to be collaborative. So physician assistants work with physicians and other members of the healthcare team to provide care to patients.
Oh, that's great. Forget my ignorance, but those are the things that sometimes you don't know the difference when you go to the doctor's office. So I think this is going to be great education for our audience, especially patients. So it has been projected that patients will be experiencing even more interaction with physician assistants in primary care settings. At the doctors focuses more on acute cases. And patients coming to the office for routine examinations and treatments will be seen by physician assistants. How are you preparing your students to assume this very important role?
It's another great question. As I said before, the physician assistant education is broad, which means that they're very versatile and they're collaborative. So in their education, they learn how to really perform basic tasks in medicine. They can take histories, they can perform physical examinations, they can order lab test and interpret those results, order special studies, refer to consultants. And as I said before, work collaboratively with the healthcare team to increase access to patient care. As an educator, I'm dedicated to training those students to be able to provide care in all areas of the country. There are some areas of our country which are, we don't have as many providers as we do in others. So we're trying to increase access to care across the country. And we're trying to groom the future PAs to be patient-centered and to also have resilience and to be forward-thinking, as well as being involved in scholarship and leadership.
That's great. Now I want to talk about the Sidz Kidz, which is
sure my favorite.
I'm very excited. My favorite part. You are founder of Sidz Kidz, and first, explain to us what Sidz Kidz is, and tell us more about the work of your organization.
Sure. So it's been a journey, and I'll tell you how the journey started. I've practiced clinically in cardiology, as you said, for over 20 years, primarily in adult and adult subspecialties. One day back in 2013, I was watching the news, and there was a story about a 16-year-old basketball player, Wes Leonard, who had played in all 4 quarters of a championship basketball game. He took the winning shot and he collapsed on the court. And the assumption by many people in the stands, because he was young and healthy, was that he was dehydrated or fatigued, but he actually had experienced sudden cardiac arrest. And they were not able to resuscitate him, in part because the AED, or the automatic external defibrillator, when it was brought to him, the batteries had not been maintained. And I grappled with that story a lot because I couldn't understand how that happens in our country when we have such a progressive, understanding of medicine and all the research that we've done thus far. So I brought that question to one of the physicians, the cardiologist that I work with, and the response was, well, we can't screen every kid. And I just could never accept that as an answer. And I couldn't accept that the conversation had to end there. So I kept pushing and pursuing, and ultimately decided that I would like to find a way to screen children for underlying conditions that would put them at risk for sudden cardiac arrest, and to work on AED availability and emergency plans for schools. And so I initially developed Sidz Kidz with that in mind, that I would actually participate in screenings. And then in that journey, I came across Darren and Phyllis Sudman from Simon's Heart. And Simon's Heart is another not-for-profit organization that I work with, and that is the sole mission: prevention of sudden cardiac arrest in youth. And we do community screenings. So that was another not-for-profit. I ended up not pursuing any kind of for-profit route, and I still work as their screening coordinator with Simon's Heart. But along the way, I still had an interest for pursuing my own path, and how am I going to make a difference. So Sidz Kidz was named after my goddaughter, who was born with congenital heart defects. And we were very fortunate that we were able to intervene with surgery, and she's had very good care. But that experience really taught me what families go through when they have a child who has really any type of medical condition, that requires extra care. And so my goddaughter's name is Sydney, and so therefore I named my organization Sidz Kidz. And what I decided in pursuit of my own journey was that I would write a book. And the purpose of that book would be to provide some form of comfort for a child who actually was undergoing that type of cardiology examination, who was in the hospital, in the doctor's office, and give them some sort of comfort and friend, to accompany them along the way, as long as a tool for parents to be able to comfort their child. My my goddaughter's mother, my sister, would call me with so many questions when all of this was occurring. And I know that she had very good providers and they gave her information, but it was difficult for her to process it and to retain it. And so I find that the parents, right, and family members of these children need some tools in order to better answer their questions, their own questions, their children's questions, and to help them feel better along the way. And so that is where the idea for Sidz Kidz and my book, The Heart of a Bear Gets His Heart Checked, came from.
Yeah, that's actually was my next question, but you kind of answered that, because I was looking at your, I saw it on Amazon, the book titled The Heart of a Bear Gets His Heart Checked. And it was such a fun and creative story that you created, especially to capture the younger audience. So I think that the message of the book was you wanted to make it fun, but then you also wanted to bring awareness to the children from a very young age to take care of their heart. So that was kind of, I love to read it. I haven't read it. But
well, the story is modeled after, there's a lot of symbolism in the book from my life and from my experience with Simon's Heart in Sydney. And really the story is that Bear goes through a heart screening. So when we do heart screenings with Simon's Heart, we do things such as check blood pressure, do an EKG or electrocardiogram to check the electrical activity in the heart. And we do ultrasounds or echocardiograms to look at the motion of the heart and look at the structure of the heart. And there are physicians and other providers there that help to provide that screening. So I thought the story would be about him going through a screening, but those tests are the types of tests that children will get when they go to the cardiology office or if they're in the hospital, etc. So it was a little bit of education for the children so that they would understand what to expect if they were going to have any of those tests, and again, give the parents a tool so that they could help explain that to the children. And for it to be a little bit less scary. So the characters in the book are friendly and welcoming to Bear, and help to assure him as he goes through this process. So you'll meet Muriel, who is the physician assistant in the book, and you'll meet Eli, Captain Eli, who is the EKG machine, and he is actually modeled after my son, who is in the Air Force. And you'll meet Sydney, of course, the stethoscope, who's named after my goddaughter, Sydney. My daughter makes a guest appearance in the book, but she's at the registration table. So her image, the girl in the book, looks like my daughter. The EKG machine, we worked on that illustration a lot because I wanted to capture my son's eyes, and I think we did. And so there's that. And then Dr. Fish, who Dr. Frank Fish was my mentor in cardiology. I worked with him for many years in private practice, and he is one of my favorite people in the whole world. So there's symbolism too. So it was important for me in the book to include those people in the story. So.
You covered everyone. I like that you covered everyone and give everyone a character. So right. Yeah, again, I just can't wait to study it or read it, because you don't really see those things. It's always a book for adults or in medical school, but nothing for children. So we appreciate you putting the hard work to create something like that.
Thank you.
Now, I want to finally ask you your advice that you can give parents with children that are experiencing chronic illnesses at a very young age, whether cardiac illnesses. As a clinician, how do you help these parents cope?
That's a really good question too. I think that it's important for clinicians who have pediatric patients to understand that we really train our physician assistant students, right? And as PAs, we approach the patient as a whole person. And I think that goes one step further. When you have a pediatric patient, you have to also include the parents, the family in that, because they're going through that with their child. And so it's very important that you understand that sometimes you do have to say things more than once for a family member to retain information, because a lot of times they're trying to process, especially if it's new information. And I think that it's just as important that you listen to parents as you actually speak to them, because parents, no matter what is going on, always know their child the best. And so you have to take input from parents and weigh that seriously when you're having conversations with the parents about their child. I think it's also very important for the patient, the pediatric patient, right, to understand as best you can. Part of your conversations with them directly should be that even though there is something that's different about their heart or their lungs or whatever it is, whatever underlying medical condition that they have, that doesn't mean that they themselves are flawed. And that's part of the message in my book, is that even though maybe some children have something that's different with their heart that requires extra care, it doesn't take away their ability to love or to be loved, really. That's not affected at all. And I think that that's an important, really important message to give to the child. And then the most important thing, I think, is community. And so engaging the children in community with other children, or even this way, right, through books or through media, that makes them feel as though they're not by themselves or different or unique necessarily, that they do have support by peers. And the same for the parents. I think that for parents to be able to speak to other parents and to get that support, to be able to support each other, is very important.
Yes, definitely. Support is very important. Education, support, and you make it very fun for the audience.
I tried to. Yes, thank you.
Well, Renee, thank you so much for joining us today. We really enjoyed talking to you, and we wish you the best. And thank you again for joining us.
Thanks so much.